I've been a practicing clinician for the last 33 years, and I've seen a lot of patients with heart attacks over that period of time. Approximately 1.5 million heart attacks occur every year. There are 500,000 deaths from heart attacks a year, and in addition, 230,000 women die from heart attacks every year. One of the most important statistics, I think, to remember and keep in perspective is that of those that die from heart attacks, 50% of those patients die in the first hour outside of the hospital. So it's important to get immediate care, to recognize the symptoms of a heart attack and act on that. Usually you hear of patients presenting with a very heavy feeling in their chest. They may not actually call it pain. It may just be a heaviness. Some people describe it as an elephant sitting on their chest. There is oftentimes associated shortness of breath. There may be radiation to one or both arms or the neck, and oftentimes their patient may be sweating as well. Those are the common symptoms that you see. If you think you're having a heart attack, I think the best thing to do is to call 911 first. If you're with someone, have them call 911. And then the most important thing you can do is chew a baby aspirin, an uncoated baby aspirin. And I think it's important to have baby aspirin around in the house in case you were to have a problem like this. But chew a baby aspirin and then try to stay calm and rest and wait for the ambulance. It's important to have the ambulance take you because nowadays they can actually transmit the EKG to the hospital. The hospital can be on alert for you. They can give you medication to control your blood pressure on route, establish an IV, give you oxygen if you need it, and give you medication for your pain as well. So it's a good idea to call 911 if you're having chest pain. A family history would be considered a significant risk factor for heart disease, and I think that just means that you need to be more vigilant in terms of watching for heart disease and have regular checkups and watch your cholesterol and watch your blood pressure. And it does make you more prone to heart disease, but it does not necessarily mean that you're going to develop heart disease. And I think it's very important to maintain an active lifestyle, exercise as much as you can, eat the right foods, and those things would be foods that are low in fat, and also eat fruits and vegetables. That's very important. Avoid smoking, avoid alcohol if possible, and I think you want to maintain your blood pressure. If you do have a diagnosis of diabetes or hypertension, you want to take your medications, be compliant with your medicines, and follow up with your doctor as well.